All right, this is your basic foyer.
Yep.
Patients come in here, they fill out paperwork, they can sit there. People can come out here, have phone calls if they're getting IVs and the like.
Yep.
Reception desk.
Blown glass up at the top, let's not forget.
Blown glass, yes. Blood pressure station. Patients get their blood pressure taken at the beginning and before they leave. So that's our blood pressure station before and after they have the blood pressure taken. This is where the IVs are mixed. This is the infusion room. Everyone gets to sit so that patients understand that being ill is not a curse. They're not in it just against the universe. They have other people who have similar problems. They can make relationships, bond, discuss issues, help each other out. So healing requires, if you will, a village to get over it.
Now what are these that I'm seeing right here? What's this all about?
That's just a nebulizer. That's a machine when you plug it in, circulates a lot of air. And then attached to that, there's a set of tubes and then a container and then nebulizes it. It's mainstream medicine. And people who have like asthma or COPD have these machines or machines similar to that at home where they nebulize different compounds.
And why is there a bell?
Because if someone has an issue, they ding a bell and people come.
Okay.
Either that or
I've never seen a bell like this in an infusion room.
Well, I mean, we are walking around.
Yeah.
Sometimes patients or staff needs to go to the bathroom, believe it or not.
Yeah.
And so if there's an issue, someone can ding the bell, but more often there's always someone around here. And sometimes you're not paying attention, you're looking the wrong way. So this is a way of getting people's attention without having to scream or raise your voice. It's just a way of attracting attention and getting the job done. This is for the patients to cook their meals or warm up their meals or just hang out or do whatever they need to do. Also, the caregivers are invited to come and spend time here with their loved ones. Sometimes the caregiver has to do some work so they can sit down and have a work area where they can communicate with their job if that's what they're doing.
I noticed up here too that one of your patients was kind enough to put together a recipe book for the campers. Her name is Diana and Jamie Long, and they put together this whole incredible recipe book by hand. Mm-hmm. What a good, that's nice.
Yeah, well, this is part of the camaraderie that the patients develop and help one another so that they can find recipes that they like. If they want them, we can Xerox it for them. They can try them out. When they do come here, part of the orientation is the diet recommendations. Part of the camaraderie is to help all of us help the next generation, if you will, to have an easier go at it. This room right now is where we hold our orientation. Patients come in here. One of my staff sits down, goes over the diet and other aspects of what to expect with Utopia, goes over their calendar, their schedule for the week, and answers a lot of the questions of just logistics, of just the mechanics of how it all works, and just allows them to sort of equilibrate, because it's a whole different experience when you come here, because most patients are used to being in an individual room, a little basically a 6x4, 6x6 room by themselves, waiting for someone to show up and do whatever it is. Here it's more of a communal effort, and there's some adjustments that need to be made, and we're just trying to help them ease in. This is our far infrared sauna suite.
Okay.
You have the sauna, you have your own shower, your own bathroom, so that again,
far infrared, you said?
Yes.
Is far infrared better than near infrared?
I believe so. I think the far infrared will generate the temperatures within the cells
HBOT?
Yep, HBOT. This is where patients sit in it. Patients have a handy talkie that they can converse with the staff so that they're not alone. Any issues, we can control it from the outside. They have the ability to control it from the inside remotely so that they can stop the treatment anytime they want, or we can stop the treatment anytime we want. And then let them out, and works very well.
HBOT is acronym for what?
Hyperbaric chamber, hyperbaric oxygen therapy. This is Dan's office. Dan is our counselor.
All right.
He has individual sessions in here, and these facilitate the ability to help people navigate their own individual problems. When we do have our Wednesday group session, we talk in generalities, not specific, so that it's not threatening to the patients. And the whole purpose of the Wednesday therapy is hopefully you'll see yourself when someone is speaking, and it's remarkable how people are willing to give other people advice they're not willing to take themselves when they have the same problem. So that's the whole focus of why we have a group therapies or group sessions every Wednesday. And this is Sydney's office, and Sydney's like my pseudo daughter.
All right.
And she's a really great asset. I mean, the girl's a real whippersnapper. She's got really, she knows how to think fast. She knows how to articulate, explain things to patients. She's pretty much nuts and bolts and gets to the point of the crux of the problem, which is great.
And what is this here?
This is the Imago. This is the sensitive Imago machine.
So a patient comes here to the sensitive Imago and does what?
He holds on, or she holds on to, he puts on the headsets,
Okay.
and then they put their hand on the plate, and they hold the other one with the headset, and the machine goes and does its thing, records the information on this computer. We then generate a printout and give it to the patient, explaining to the patient what the printout means. And then we repeat it a second time before they leave. And then the machine has the ability to compare where you started to where you're at.
This is a diagnostic tool for healthcare? Is that, I mean,
Well, not in this country.
not in this country. So where does this technology originate?
Russia.
Russia. It's been around a little while, huh?
Oh, it's been around quite a bit.
Okay.
This is not the first rendition of this machine, but it's a wonderful machine.
Great tool. Okay, fantastic.
This is the massage therapy room.
Okay. So how often do patients get a massage here?
At least once a week, more often if it's indicated. And here's where we do lymphatic massages and the other types of massages that we do. Across the hall is one of our two colon therapy rooms with the machines.
For detox?
Yep, clean out the colon. It has its ensuite bathroom. And we have the staff lounge, staff bathroom, all sorts of stocks that we have, IT room, my office,
Your office, right? Got it.
and then Mark, the manager's office, Tracy's office, and last but not least, the other treatment room that we use, which also can double as a second colon therapy room.
Got it. Perfect.
And that's our humble abode.
Fantastic.